Hi, my name is Greg Fell. I'm Director of Public Health Sheffield. So this is the weekly update, current as of today, 13th of October. I'll talk about epidemiology first, then I'll talk briefly about the restrictions that were announced last night, and then I'll talk the forward look and the strategy. So epidemiology, as of yesterday, 7-day rolling incidence was in the order of 450 per 100,000. Some signs it's stabilising, probably a bit too early to call definitively. I've said before, I'll say again, that almost all of that increase over recent weeks has been in 15 to 25 year olds, particularly in about 18 to 25 year olds. We've welcomed tens of thousands of students back to the city, and that effect has been noted in university towns across the country. And of the university students, mostly year one students, mostly freshers, not all, but mostly freshers. And as I say, some signs of stabilisation, too soon to call. I'm hearing that in Scottish universities that have been back a good few weeks before the English universities, that there has been a big spike and then some stabilisation. So we watch that like a hawk. I've said before that there was zero chance that increases in COVID in the young would be contained in the young. So we are seeing spread in the 20 to 30, the 30 to 40, and kind of going up the age cohort. There's an appreciable spread now in the 65 plus age cohort, which is the one that worries us most from the morbidity and the illness that comes from this. Doubling time for all age cohorts is in the order of 7 to 10 days, a bit less than that, but it's in that order. And that's showing no signs of slowing. Hospitals are beginning to be busy, an appreciable number of admissions, and an appreciable number of people in hospital on either oxygen or on a ventilated bed. So what we feared and what I've warned of is beginning to happen. You can see it happening in other parts of the country, and there's no doubt it will come to Sheffield. So I'll say before, I'll say again, it will be a difficult autumn. That underscores, one, the perilousness of our position, and two, the importance of us all acting safely and responsibly and keeping ourselves and others safe. Second point, the restrictions that were announced yesterday by the Prime Minister in Parliament. Sheffield and South Yorkshire are in a high alert level, or the medium risk category, and that does entail further restrictions to enforce or to encourage social distancing. So in short, and you can see them on the web for yourself, but people mustn't socialise with anybody outside their household or their support bubble in any indoor setting, whether at home or in a public place of any description. People mustn't socialise in a group of more than 6 outside, including a garden or other spaces like beaches or parks. Businesses and other venues can continue to operate. Obviously, it goes without saying in a COVID secure manner, and businesses have implemented that across Sheffield. Certain businesses selling food or drink will be required to close between 10 and 5. The curfew that's been in place for a couple of weeks now. Schools, universities, places of worship can remain open. Weddings and funerals can go ahead with restrictions on the number of attendees. Exercise classes and organised sport can continue to take place outdoors. These will only be permitted indoors if it's possible to avoid people mixing with people they don't live with or share a support bubble with. And people can continue to travel to venues and amenities which are open for work or to access education. So there's some significant additional restrictions there, and they're certainly not trivial and certainly not something that we're taking lightly. I guess it goes without saying, but I'll say it, people should continue to wear a face covering in areas where this is mandated. Personally, I'd go a lot further, and I'd recommend that everyone wears face coverings in places where they're not mandated. They keep us and others safe. Follow social distancing rules that are already in place. Work from home where you can, and if you are going to work, walk or cycle if possible. So the link to the restrictions will be at the end of the video. Lots are asking me and others about, well, can I do this and can I do that? There are countless permutations of nuances and discrepancies, and lots of issues where it's just not quite clear. Certainly lots of specifics to attend to and some outstanding uncertainties to attend to. My sense is we all want explicit instructions for the limitless scenarios that will come across us. We can't give them. So I come back time and time again to the basics and trying to cut through the confusion, and throughout all of the guidance and all of the nuances, come back time and time again to the basics. Wash your hands. This is the most common way of picking up a virus. You touch a surface that has an infection, has a virus on it, you put it to your face, that's an infection. Distance, 2 meters or more, preferably. Face masks, they protect you and they protect others. And social mixing, household mixing is the business end of this. It has always been and probably remains to be. And if you, as I said on the previous clip, if I have 5 people in my house today, 5 different people in my house tomorrow, 5 different people in my house the day after, that is consistent with the rule of 6, but that's 15 different social circles. So my approach is to have one network, a smallish network, and to stick to it. The city continues to focus its efforts on trying to cut through some of the confusion, because there is some, let's be blunt about that, and to try and work on the basis of consensus and consent. That takes us then to the where next. The basics of our strategy remain intact. Fourfold: protecting ourselves from a dangerous respiratory virus, particularly protecting the vulnerable, protecting us from social and economic harm that come from efforts to suppress the virus, and that's the point about getting the economy going and following government guidance. They remain the basics of the strategy. We will and are continuing to intensify our efforts in all sorts of different areas, from prevention through to enforcement, and we are enforcing the law, through to the work that we do on communication, messaging, marketing campaigns, through to our efforts around contact tracing and isolation. The basics remain. So you wash your hands, keep your distance, wear a face covering. If you're asked to isolate, please isolate. If you get symptoms, get a test early. Those are the basics. I've reiterated those on many occasions. We have some asks of government, and there's a couple that are worth bearing in mind. One is our ask of government is rapid test results. So we've encouraged people to get a test if they've got symptoms. That the test result needs to be back quick. And our ask is rapid and complete contact tracing. Done too slow, it doesn't work. So it needs to be quick. The restrictions that are in place that were announced by the Prime Minister yesterday will have economic impact. So our other asks of government are to be really, really clear to support the economic case for businesses that will need support and individuals that will need support. The isolation one is really obvious and well trod. If I'm on a low income, I may not be able to afford to isolate if I'm a well contact of a case. So financially supporting that. So we continue to work with government to secure the best economic package for the city, but we continue to focus on the basics. The basics will remain the basics right the way through to the end of this pandemic, whenever it might be. So lastly, it is all about social mixing and social distancing, and it's clear that the Prime Minister wants to keep education open and wants to keep business open as and where it's possible. So that limits our ability, and understandably. So we will continue to focus on household mixing. The restrictions that were put in place yesterday will definitely have an impact on the hospitality sector and pubs in particular. And so we need to support that where we can. I guess goes without saying, and we're trying to optimise the economic support package for the city. So the restrictions will be reviewed every 4 weeks, or possibly more frequently than every 4 weeks. And I think my message to the city is this: the government has demonstrated that it is willing to go further, has done in lots of other cities, most obviously at the moment, Liverpool City region. Once we're in this. It remains beholden on us all to be sensible, to protect ourselves and to protect others. The best way to protect our loved ones is to keep the level of spread as low as humanly possible. And we're working with government to identify what the exit strategy for any restrictions that are imposed is. Equally, there may be intensification of the restrictions, and we may move to a very high level of risk. That all depends on the epidemiology, which all depends on what we do.